There's a lot happening with New Jersey's child welfare system. We want to help you make sense of it and share our story. This is DCF on the Air.
This is DCF on the Air, and I'm Jason Bukowski. DCF on the Air is a production of the New Jersey Department of Children and Families, and each month we'll be using this space to have a conversation with all of you about the important topics connected with our efforts to transform into a family well-being system. Right now, many families with children and adolescents are struggling with the effects of a youth mental health crisis, which has certainly been exacerbated as a result of the stress of COVID-19, but was by no means created by it. The underpinning factors are many. It includes increased use of social media in favor of in-person connections, increased pressure to excel in academia or competitive sports, political and racial divisions within our country, and an atmosphere of fear created by bullying or school shootings, among so many other contributing factors. This is not just a New Jersey problem. In the last several years, we've heard from the U.S. Surgeon General and the CDC about staggering statistics related to youth depression, anxiety, and suicidal ideation. The most recent CDC report included data from 2021, so this is data taken from the midst of the pandemic and reported by the youth themselves. And according to their results, nearly 1 in 3 teenage boys and 3 in 5 teenage girls had reported feelings of persistent sadness and hopelessness, an early marker for depression. 1 in 4 girls said they had seriously considered suicide, up significantly since 2011. 1 in 10 said they had attempted suicide. Alcohol use is on the rise again, more so in girls than in boys, but generally speaking, it's increased across the board. So with these numbers in hand, what do we do? There's certainly no one-size-fits-all solution, which is why in New Jersey, we have several programs and initiatives focused on youth mental health and well-being, all of which we'll be exploring on this podcast over time. But today, though, we're focusing on a new effort, the New Jersey Statewide Student Support Services Network, or NJ4S, which we've designed to provide upstream prevention and mental wellness and well-being services to students within their schools and trusted community settings. This is about identifying and connecting with young people before they need deeper end therapeutic support. It's about giving them the tools to cope with stress, anxiety, and situational depression, to identify where there may be a clinical need, and referring to other components of the youth behavioral health infrastructure in the Garden State. Joining me today is Sanford Starr, Sandy to his friends, who serves as Assistant Commissioner for the Division of Family and Community Partnerships in DCF, which will be overseeing the rollout of NJ4S across the state. Sandy came to us in the early days of the pandemic, having previously served in roles connected to addiction services and mental health in Ohio. Sandy, thank you so much for joining us today on DCF on the Air.
It's a pleasure to be with you, Jason.
Great. So let's jump right into it. Can you tell me a little bit about NJ4S? Mm-hmm. Specifically, what is it? When can we expect it? And how do we envision it supporting New Jersey's student population?
Well, the idea of NJ4S is to provide prevention and early intervention services in a statewide format for New Jersey for the very reasons that you described. We're seeing a much higher rate of concern about mental health issues for students. Sure. And it's to the extent that I don't believe we can therapy our way out of this. And so to provide the prevention and early intervention services to help mitigate the need for higher end services is a much, I think, much better long-term solution for the state.
Yeah, so we're not saying that this is necessarily intended to be a therapeutic support. It's really more focused on being a part of like a larger continuum.
Yes, a problem like we're seeing in New Jersey and nationwide really calls for a multi-pronged approach. A full range of intervention services from primary prevention, secondary prevention, through treatment, like the treatment that our children's system of care has to offer, and then crisis services. So our niche in that continuum is really on the prevention portion of that spectrum. And we're not the only prevention service by any means. Sure. There are many others. But we're designed specifically to work within the schools and in communities across the state.
Great. So I know that prior to NJ4S, New Jersey had a network of school-based youth service programs, very much beloved school-based youth service programs. This has been in place since the 1980s. How does NJ4S differ from our SIBIS programs? And will those programs still be operating in schools when NJ4S is rolled out?
Great question. So the school-based youth services programs have been with us for quite some time,
Sure.
35 years now. And they're going to continue. They're continuing through this next year. There are some key differences. The school-based youth service programs currently operate in 86 schools, and they will continue to operate in those 86 schools. The advantage of school-based youth services is that with staff that are based within the school building, it means that those staff really understand the culture of the school, and they're right there to assist students who may be in need. So there are some real strengths to a school-based youth services program approach.
Yeah.
That strength is also sort of a deficit that NJ4S can fill. NJ4S is a hub and spoke model, which means that we have we'll have 15 hubs, which are administrative centers that clinicians and prevention consultants are housed in, if you will. Not necessarily physically housed, it could be virtual as well. Sure. But they're the administrative arm of NJ4S. And those counselors and prevention consultants can be deployed to a variety of different schools and school districts across the state to provide evidence-based prevention services and provide brief interventions and referral to ongoing treatment in the community. So the strength of a hub and spoke model, if you will, is the ability to have great geographic reach and spread. I think that other, key distinctions between school-based youth services and NJ4S, because we're not talking about one being better than the other, they're different, is that we're able to be scalable with NJ4S, meaning that we are able to provide services to many schools, and those services can also be deployed differently in different communities. Okay. With our school-based youth services programs being housed within a school building, we don't have that same luxury of being able to deploy the same individual across a number of different settings. Yeah. And the reality is, as much as I know some folks would like to be able to expand school-based youth services, the cost and staffing are prohibitive.
Yeah, and I think because we've had this conversation a few times now, you and I, on different media sources, and when we talk about those 86 existing school-based youth services programs, that's out of 2,400 schools roughly in the state of New Jersey.
It's over 2,500 schools all told.
Sure.
And so the ability to provide staffing to all schools is really insurmountable. But with an NJ4S hub and spoke type of a model, it means that we can come in and out of schools who are in most need and be able to prioritize those services accordingly.
Yeah, and I think especially when we're considering the fact that there are workforce challenges and workforce needs throughout sort of the social services spectrum right now, it's not just about funding. We could fund our way through this. We still wouldn't have the clinicians and the prevention specialists to be able to staff these programs.
That's exactly right.
Yeah. So I want to go back to what you were talking about in terms of the hub and spoke model. I think you kind of touched on this already about, why we think this is sort of the best approach, not necessarily better than school-based, but it's different, I think is what you said. But why do we think this is the approach right now in order to address these needs?
Well, given the New Jersey is one of the most diverse states in the country, and a one size fits all approach is not going to suffice. And being able to create these hubs that can be deployed to different areas in the state, different school districts, different schools, based on need. It helps us to ensure that populations of students or districts where students would not normally have access to these services will be able to get them.
Okay. When you say that, are you referring to that there aren't services within the community already, or are you referring to something else?
Well, there are services in the community already. And I think that part of what we're looking at with the hubs is that they are going to need to develop relationships with existing community services. We said earlier that this was a multi-pronged approach and that this was not the only prevention program or the only treatment program available. It's really a matter of developing relationships with other programs that exist in the community to ensure that there's access to students. You know, one of the things that we learned a couple of years ago with the Human Services Advisory Councils, the HSACs, I think I have that acronym right.
I think so, yeah.
Is that in the county needs assessments that were conducted, one of the chief findings was that individuals were not aware of the services that were available in their own communities. And so in addition to providing the direct services, prevention services, and some brief intervention and referral services, the NJ4S hubs are also serving as an entity to help align other community resources for students and their caregivers. To ensure that everybody is aware and playing their part.
Great. And I think it's also about avoiding duplication of effort too, because when we're talking about, this great need, I think it's really affecting communities across the entire spectrum. It's not really connected to socioeconomic conditions. It's not really, everybody has some component of need, I think is what I'm trying to say. But to be able to leverage those resources to avoid duplication of efforts and to maximize sort of the state investment, I imagine that's part of it as well, right?
Absolutely. Absolutely. And in part, that's why each of the hubs will have an advisory council that they'll work with. And that advisory council will be comprised of students, parents, community representatives, business, faith-based organizations, folks that will have an idea about other programs and services that could be made available to students and their families through the community. They'll also be able to advise on the types of programming that they'd like to see the hubs emphasize to assist students in being successful in school.
Great. Can you talk a little bit about how we're targeting services so that we can have sort of an incremental response to the needs of the student population? Because I know that not every student is going to need you mentioned those briefer clinical interventions, which I think is sort of the top level, but not every student's going to need those particular supports.
Correct. So actually the NJ4S hubs are created to provide 3 different tiers or levels of service. The Tier 1 service is actually available to every student and every caregiver in the state. These are services such as webinars that can be recorded so that students or their parents can watch at their leisure. They may also be community presentations that can be held either in a community setting or in a school setting that anyone is able to attend. So just as an example, there may be a webinar created for parents of kindergartners and how to get your kindergartner off to school on the first day very successfully. Okay. There may be a webinar for seniors, for college or for high school students. Not college. We're focusing on middle and high school here.
Yep. Don't give us more work.
No, we have enough. But there may be a webinar on how to handle test anxiety,
Okay.
or how to recognize that a friend is in need of help. So there are a number of webinars that can be done, as well as in-person community events that anybody is able to attend. And all of these events can be created to focus on either a particular grade. It may be focused more on assisting parents, or others may be in assisting students.
Yeah. Now, there's something you said there that I kind of wanted to focus in on in terms of NJ4S actually being a support to parents. Why is it important to also address the needs of parents and families as a whole?
So some of the studies that you cited, or the reports that you cited from the CDC, and there's a Surgeon General's report, and also some data that we've collected right here in New Jersey, really highlight the fact that when parents are in distress, so are their children, so are students. So for parents who may have a substance use disorder, may have mental health issues, unemployment, food shortage, all of these things have a bearing on students and how they're functioning at school during the day. So if there are ways that we can also connect their parents with, or caregivers with, needed services, that's another really critical role that the hubs can play to help ensure student success.
Yeah, and I think that when we think about supporting students, it's always very student focused or student organized. But I think incorporating that sort of larger picture and, being that connector, again, I think, as you said, with the HISAC needs assessment, there were programs that were available that people just didn't know about.
Right.
So, and I'm sure that that's across the board, whether you're talking about student services or family services and parent services, caregiver services.
Exactly.
Yeah.
So we'll work with both the student as well as the caregiver or parent. So that's Tier 1 services.
Mm-hmm.
Tier 2 services, schools will apply for. And these are evidence-based programs. And so the school, if a school has a particular problem around substance abuse or violence or bullying, or a number of other areas, they can apply to have the hub provide a service either at the school or in the community to address that issue. These will be primarily evidence-based programs. Mm-hmm. And because of such a diverse state, there are not always evidence-based programs for every population. And so it does mean that there needs to be local modification to ensure that we're addressing student needs appropriately.
Sure.
But these are going to be delivered by what will amount to 199 prevention consultants that will be deployed across the state at these 15 hubs. Yeah. And I should also point out, because I know that this has been a source of question and confusion, the services are not provided at a hub.
Okay.
The hub is administrative. That's where the professionals reside. The services are delivered at a school or in a community. And we're relying on those advisory groups that each hub has to inform the hub of where in a community makes the most sense to provide a particular type of service.
So can you provide some examples of trusted community sites that might be, I guess that would be a spoke within the hub and spoke model?
So it could be a social service agency. Mm-hmm. It could be a faith-based organization, a library, a community center. Okay. It's any place that's convenient and accessible to students and or their caregivers. And again, we can rely on the advisory group to identify what makes the most sense for any particular community.
Yeah, and I think that was one of the concerns that we'd heard originally, was that students would have to travel for services, that they may not be able to get services locally. And I think what you're saying is that not only will they be able to get services within the schools, but we're going to make it more accessible based on sort of that local voice.
That's right. We're really talking about accessibility here. Mm-hmm. For many students, it will be in the school building. And so that's where we will deploy the NJ4S staff.
Yeah.
But there are also times when a parent may want to be seen for consultation, and it's after school hours. The school's already closed. So we're looking to see how we can make the programming more accessible to students. This actually came out of some of the earlier focus group work that we did, sort of as a preamble to creating NJ4S, where we learned that there were a number of students who really liked the idea of being able to have the services right there in their school, but there were other students, especially when it came to any kind of counseling relationship, where there were a number that preferred to be seen elsewhere and not in the school building. Yeah. And so, this is really all about choice.
So on Tier 2 services, we're still in the realm of prevention services, correct? Right. Okay. So we still haven't even approach the clinical interventions that are available through NJ4S. Can you talk a little bit about those?
Sure. So those are Tier 3 interventions where we have mental health counselors that are also available, and this is really intended for brief intervention. And if ongoing mental health counseling is necessary, the counselor will make a referral into a community agency or a community resource. Okay. So brief interventions. Events that may interfere with students' success in the classroom, and what can we do to help you get back into the classroom and be successful. The clinicians can also provide consultation services to school staff if there is an issue around classroom management. If the clinician is able to assist with that at all, they can. Really, we're not going to be designed to do crisis counseling. Okay. And so I think one of the things that we will be providing additional guidance on as we, begin ramping up for these services is that we do have the mobile crisis unit when there is a real crisis. And we expect that the schools will continue to use the mobile crisis unit. Yeah. And I think that also getting back to, the discussion that we had earlier about not wanting to duplicate services, many schools already have relationships with some type of mental health counselor or some type of mental health work, whether it's in the school or in the community. And we're not looking to interfere or change any of those relationships. We're really there to be an addition and not a replacement to those existing services and relationships.
So it kind of reminds me, in my early days, I did campaign work, and we would do what was referred to as get out the vote drives, where we would make sure that everyone knew to come out, and today was the day you had to go out and vote. And we would do something called overlays. So we would have our typical people would go out and knock on doors and remind people to vote, and then few hours later, someone from labor might come through and knock on doors and tell people it was time to vote. And then we would have phone contact to let people know it was time to vote. And usually by the end of the day, people were very annoyed with us because there was a lot of different contact, but it made sure that the message got through. And I think that's sort of what we're looking at with NJ4S as well, correct?
That's right. And we still have a few months before things go live. Our timing is to be ready for the new school year in September. Okay. We've just made the awards to the 15 hubs, to the social service agencies that are going to be receiving those awards. And there's a lot of work that we need to do between now and September to have those hubs ready. We need to have those advisory groups formed. We're working on a brand new IT system so that we can do a good job with applications for service, as well as managing the services that are being provided across the state. As I was saying, some guidance and some training that we're going to be undertaking. But it looks like we are on track to be ready to roll in September to launch this program.
Well, it's fantastic to hear, because I know it's needed. I know it's so needed. Thinking, looking into your crystal ball and thinking ahead to, 10 years down the line or 5 years down the line, where do you see NJ4S in that time? How do you see this sort of evolving or transforming to sort of meet the needs of students within New Jersey?
That's such a great question. To be honest, we've been so wrapped up in just getting this program launched. We haven't really thought that much about what's happening down the road. Mm-hmm. But I think that if we're able to demonstrate that the programming that we're providing across the state is of benefit to students and their parents, and a benefit to the schools, where we begin to see a change in some of the data that is routinely collected on an annual basis around levels of violence in schools or substance use problems that students are experiencing, that I'd expect that we would see students who feel much more connected to their schools in the long run, that have positive peer relationships in the long run, that have good relationships with their teachers and with their parents. Those are the signs that we are making a contribution to that end. And by no means would I be implying that this is the only thing but this is, I think, an important component of that recipe to get us there.
Yeah, and maybe even seeing NJ4S replicated in other states.
That would be a real honor.
Okay.
But right now, we're going to stand it up here in New Jersey, and we'll be the first.
Great to hear. And thank you for taking the time today to talk to me. Thank you for all your work in this important area. I know that you have a very busy schedule these days. I think we all do. But thank you for taking time to talk to us. If you want to learn more about this exciting initiative, visit www.nj.gov/DCF/NJ4S.html. In 3 weeks' time, we'll be back with our guest, Dr. Rebecca Bryan, talking about the New Jersey Office of Resilience, which is again tied into this concept of a continuum of care, from wellness to resilience to mental health. On behalf of my producers and the DCF Office of Communications and Public Affairs, this is Jason Bukowski signing off. Tune in at the end of the month for more DCF on the Air.